Hi, my name is Nathan. This is my Shin Splints, or a more medically correct term, medial tibial stress syndrome grade 2 injury rehab program. This program is specifically designed for an athlete who plays hockey as the main sport, but this program will also work with other competitive team sports such as football and rugby, of course, excluding the ending 2 weeks, which are all hockey based exercises. This next slide shows my whole 8 week rehabilitation program and what days the athlete will be performing the exercises on, and also the overall quantity they will be completing on that day. Looking at the program, you can see that there are 5 different sections. These are the sections that highlight the intensity and or the type of exercise the athlete will be doing over the weeks. Some key points on the 8 week program: the pain level of these exercises throughout the entire program should never exceed 3 out of 10 during or after performing the exercises. And the stages of the program have some overlap between them because week 5 introduces controlled running, leaving out less space for other exercises. The pink boxes represent the injury protection stage, otherwise known as the warm up or prerequisite stage for the main program. The first step of this program requires applying the PRICE, which stands for protection, rice, ice, compression, and elevation, as the warm up. This will be done straight after the athlete has been injured. The PRICE principle serves as a standard approach for treating soft tissue injuries because it helps decrease the swelling and pain while creating conditions for successful recovery. The exercise program starts with PRICE implementation to handle any existing swelling and discomfort and tissue irritation. This has to be done for at least a couple of days, ideally as much as the athlete can within the time period. The joint motion recovery stage, shown in purple, is the first phase of the program that takes place during the first 2 weeks of rehabilitation. The goal of this stage of the program is to restore normal joint movement restricted by the injury, by the swelling or immobilization of the injury. Exercises in this stage are low intensity, controlled, and assisted, focusing on gentle movements that improve circulation, reduce stiffness, and support healing without stressing the injured area. The first exercise that I'm demonstrating is a passive exercise from the joint motion recovery stage, ankle circles. This exercise is completed once the ankle has been rotated 10 times 360 degrees both ways on both legs. This has to be done for 3 sets. This exercise can be performed anywhere as long as your lower leg is elevated and not touching the ground or anything else around it. The goal of this exercise is to activate and strengthen the targeted muscles while minimizing stress to the injured ankle joint, promoting both stability and controlled movement throughout the bottom leg. The progression movement for this exercise would be adding weight or resistance to the end of the ankle, such as ankle weights or resistance band. This will increase the load and make it harder to move the ankle in that circular motion. A regression exercise for this is resting the lower leg in a seated or supported position, ensuring the leg remains elevated but with minimal effort, reducing the pain in the lower leg and also the ankle joint. The second exercise that I am demonstrating is an active exercise, the single leg balance from the joint motion recovery stage. This exercise is completed once both legs have been stood on for 30 seconds for 2 sets. The goal of the single leg balance exercise is to improve joint stability and neuromuscular control in the affected limb. By challenging the body to maintain balance on one leg, this exercise activates stabilizing muscles around the ankle, knee, and hip, which are essential for controlled movement and injury prevention, and can be performed anywhere on a solid surface. A progression movement for this exercise would be holding light weights to perform upper body movements while balancing to stimulate functional demands in the lower legs. A regression exercise for this would be to use a chair or a wall for support to assist with balance. The blue phase of the boxes serves as the second stage of the program, which is strength recovery stage. The main objective of this stage is to rebuild the injured area's baseline strength so it can manage rising loads and activity levels. The exercises in this stage target the muscles and supporting structures affected by the injury while simultaneously enhancing joint stability and balanced muscle functions. The athlete decreases re-injury risk through strength development, which creates a safe base to advance rehabilitation process in the following stage. These exercises are meant to be done in up to 1 to 2 minutes. This goes the same for all of the other stages. The first exercise that I'm demonstrating is a partial weight bearing exercise, which is mini squats supported. From the strength recovery stage, this exercise is completed once it's been performed for 10 reps over 3 sets. The partial weight bearing mini squats are designed to build foundational strength stability in the injured lowered limbs. This is done by loading the ankles with a partial bit of your body weight, by squatting down with your quads and stopping when the pad hits your glutes. This will help by improving muscle activation and joint control during the strength recovery stage. A progression movement for this exercise is to perform the squats without support to increase the load on your injured limb, i.e., without a chair. A regression movement for this exercise is to perform the exercise seated, to standing from the chair as an assisted alternative to reduce load on the joint. The second exercise that I am demonstrating is an isometric exercise. It is called ankle dorsiflexion self-mobilization retraction from the strength recovery stage. This exercise is completed once it's been performed 10 times, held for 2 seconds per each rep for 3 sets on both legs. The goal of this exercise is to strengthen the muscles responsible for ankle dorsiflexion while maintaining joint stability. By performing the movement isometrically, the ankle is loaded without excessive motion as you are rocking your body weight onto that ankle, targeting the joint, which helps promote strength in the injured area, improving joint alignment, and support functional movement patterns necessary for progression to more dynamic exercises. The progression movement for this exercise is to lengthen the time of the isometric hold. This will help improve muscle endurance. A regression movement for this exercise is to do the opposite and to shorten the time of the isometric hold. This helps the muscles have an easier contraction and reduce overall pain. The green boxes and or green phase of my 8-week rehabilitation plan represents the functional recovery stage. This stage is to get the athlete's body back to being able to move around normally. The main objective of this stage is to enable the athlete to regain normal movement patterns and achieve functional use of the injured area, being the medial inner portion of the tibia. The exercises at this stage are intended to enhance strength, coordination, and flexibility, while preventing high impact, fast, or deep movements that could cause further strain to the recovering tissue. At the end of this stage, the athlete should be able to perform controlled functional movements safely, thus establishing a solid base for more advanced sport-specific training. The first exercise that I am demonstrating is a stability exercise, otherwise known as box drops, from the functional recovery stage part of my program. This exercise is completed once it's been done for 5 reps, meaning that they get on top of the box and land 5 times. Also being held for 2 seconds to make sure the athlete's fully stable upon the landing, and this has to be done for 3 sets. The goal of doing box drops is to improve dynamic stability, balance, and neuromuscular control, while safely absorbing impact, helping the athlete regain confidence in controlled functional movements as they transition towards more advanced, sport-specific activities. The athlete performs the exercise by stepping off the box and landing in a half squat position with arms out in front of them. The quadriceps, glutes, and all around the calf muscles should absorb the impact from the drop. This will help strengthen your shins and all the medial part of your tibia. The progression movement for this exercise is to add single leg landings once double leg control is mastered. A regression movement for this exercise is to reduce the height of the box to minimize impact on the shins. The second exercise that I am demonstrating is a power exercise called max effort single leg hops from the functional recovery stage of my 8-week rehabilitation program. This exercise is completed once it's been done with 3 reps on each leg, landing and stopping dead. If the participant does not stop dead and touch the ground with anything that is in the foot they jumped with, the rep will not count. This will be done for 3 sets. The goal of the max effort single leg hops is to develop explosive strength, power, and reactive control in the injured limb. This is done by generating power and also absorbing impact with the athlete's lower legs. This exercise also helps reinforce proper landing mechanics and joint stability. It helps the athlete regain confidence in high impact and dynamic movements, and also prepares them for sport specific activities and more advanced plyometric training in the later stages of the program. A progression movement for this exercise and perform multiple consecutive hops will add directional changes, being forward, lateral, diagonal, etc. A regression movement for this exercise is to perform two-legged hops to distribute load more evenly and build confidence before progressing to single-leg hops. The yellow phase and the boxes in my 8-week rehabilitation program stands for the sport-specific recovery stage. This one is quite self-explanatory, just getting the athlete back into doing movements similar to their sport, so there'll be no pain while they are playing. Focusing on reintegrating the athlete into movements and activities that closely mimic their sport, ensuring that they can perform with proper mechanics and without pain. The main goal is to transition from general functional movement, which we've been focusing on in our other stages, to sport-specific skills, allowing the athlete to regain confidence, timing, and coordination in actions that they will be using during competitions. Exercises in the stage are designed to stimulate demands of the sport, including agility, speed, and reaction-based movements, while still controlling the load intensity to prevent re-injury. The first exercise that I am demonstrating is a sport-specific exercise related to hockey, and the exercise is the reaction ball chase from the sport-specific recovery stage. This exercise is completed once it has been done for 8 reps combined on the forehand and the backhand side, meaning that there needs to be 4 shots from the forehand and 4 shots from the backhand for you to complete 1 rep. This has to be done for 3 sets, and a rep is going to be completed when either the athlete has taken a shot at the goal or has lost control of the ball while doing the repetition. The goal of this exercise is to improve the athlete's reaction time, agility, and hand-eye coordination of movements that closely mimic the demands of their sport, for example being hockey. It also helps the athlete regain confidence in dynamic, high-speed actions, such as getting low to the ground, putting pressure into the ankles, and also the initial takeoff that puts a load of pressure through the legs. This exercise helps ensure that these movements can be performed safely without pain, preparing them for the full participation in training and competition. A progression movement for this exercise is to perform the drill over longer distances or incorporate directional changes to stimulate more complex game scenarios. This can be done by adding an extra cone on the diagonal to make sure the athlete has to run around it before they can take a shot at the goal. And a regression movement for this exercise to reduce the distance and the speed that the ball is being passed to by their partner, giving the athlete more time and accuracy in their foot placement and safer technique, reducing the load on the shins. The second exercise that I am demonstrating is a sport-specific exercise being hockey. It is called lateral shuffle dribbling. This exercise is completed once it's been done for 5 reps and done for 3 sets. A rep is completed when the athlete has gone from the right to the left and came back to the middle to end the rep. The goal of this exercise is to improve lateral agility, coordination, and control while maintaining proper dribbling technique, stimulating the side-to-side movements frequently required during gameplay. It also helps the athlete reinforce dynamic stability, quick direction changes, and sport-specific endurance, which is needed to reduce the stress on the shins to prevent shin splints. A progression movement for this exercise is to perform multi-directional shuffles, forward, backward, diagonal, for advanced sport-specific movement patterns. A regression movement for this exercise is to practice lateral movement without a ball to isolate movement mechanics. In conclusion, athletes who reach the week 8 of the rehabilitation program should be able to perform high-intensity field drills without any pain before getting cleared for a full return to their activities. By the end of the 8-week program, athletes gradually rebuilt strength, stability, and confidence, reducing the risk of re-injury and reassuring safe and effective return to full participation in their sports.